broadcasting live from Houston, from the space city to the world. You are watching NowMedia Television.
Welcome to NowMedia's premier medical show, Pain Diaries. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine, and I welcome you. In today's episode, we have a very special guest, a fellow physiatrist who has focused his entire career to changing people's lives. I'm ecstatic to introduce my dear colleague to enlighten us about what he has been doing with his career, his companies, and his work as a physical medicine and rehabilitation doctor. He specializes in regenerative, degenerative neurologic diseases, brain injuries and strokes, spinal cord injuries, and bioidentical hormone replacement. And his most recent project is a book called Beyond Awakenings. We have a lot in common, especially trying to change our patients' lives for the better, to reduce pain and suffering and restore function. Remember, you can find me, Dr. Suzanne Manzi, at Performance Pain and Sports Medicine. Our website is www.performancepain.com, or reach us by phone, 346-217-1111. I have two locations, 4126 Southwest Freeway, Suite 1700 in Houston, Texas, 77027, in the penthouse of the T-Mobile Tower next to Greenway Plaza, and also in League City, Texas, where I office out of League City Spine and Sports on Main Street. Don't forget, tune into Pain Diaries on the following channels: Houston 2110, Beaumont 2710, Atlanta 2210, Lake Charles 2110, College Station 1410, Eagle Pass 24, Piedras Negras 24, and hear us in Chicago on 102.9 FM and 104.3 FM in Huntsville, Texas. Don't forget to tune into Spotify, Apple Podcast, and Amazon Music, and follow us on all social media and our digital platforms such as NowMedia.com. Please note, the information in this show is for informational purposes only and is not medical advice. It is not a substitute for professional medical advice, and I urge you to seek medical advice from your physician regarding any medical condition. Reliance on the information provided in this show is provided solely at your own risk. Hello, and I'm Dr. Suzanne Manzi, and this is Pain Diaries. Dr. Suzanne Manzi with Performance Pain and Sports Medicine here in Houston, Texas. I welcome you back to Pain Diaries on NowMedia Television. I've discussed medical technology as one of my passions on previous episodes of Pain Diaries, but today I want to introduce you to functional medicine and why we use it to help our patients. Innovative devices help with structural and painful conditions, but functional medicine is all about the chemistries of our bodies and getting to the root of the problem to cure disease and create wellness. Functional medicine doctors try to identify the disease process and not just focus on symptoms. This type of medicine is very individualized to each patient. The same is true for the specialty of physiatry. Physical medicine and rehabilitation is my primary specialty. My special guest, Dr. Clarke, is also a physiatrist. We both did our residency at Baylor College of Medicine. He has taken his basic training and has become very specialized in caring for patients. He's a neuroscientist, and he continues to focus on traumatic brain injury as well as strokes. He utilizes functional medicine to help these patients he sees in his practice and in the hospital to ensure they have access to the best options for both them and their families. The opportunities are endless in helping people's lives change who are suffering. And functional medicine is one of the treatment options we utilize at Performance Pain and Sports Medicine. in hopes of relieving suffering from multiple symptoms and improving function. Stay tuned for more to come to discuss these topics with Dr. Lewis Clarke, MD, PhD. He's focused on the integration of current research in neurochemistry and the new developments in neurogenesis, neuroregeneration, and neuroprotection in the treatment of degenerative neurologic diseases such as Alzheimer's, Parkinson's, multiple sclerosis, and other lesser-known neuropathologies. He holds a patent on a special pharmaceutical called Nupinex. It's a neuropharmacology-based, neuroprotective, neuroregenerational, and neurogenesis supporting supplement combination. He treats patients with degenerative neurologic disease, traumatic brain and spinal cord injury and stroke, as well as general rehabilitation diagnoses. He's a visionary, and we are very lucky to have him on today's show. I'm Dr. Suzanne Manzi here on NowMedia TV in Houston, Texas, and this is Pain Diaries. Take care of you so you can take care of business. And we'll be right back with Dr. Clarke after this commercial break. Welcome back to Pain Diaries. I'm Dr. Suzanne Manzi, here with Performance Pain and Sports Medicine in Houston, Texas. I am excited to introduce Dr. Lewis Clarke, MD, PhD.
Good morning.
Thank you for being here.
Thank you for inviting me.
We are excited for you to take the time today to share your story on today's episode of Pain Diaries. Let's start out with a little bit about yourself and your journey with pharmacology, as well as neurophysiology and physiatry. Those are all very big words.
They are.
Tell us about your training and continued self-education to promote the health of your patients. You've received your PhD in neuropharmacology and cell biology prior to attending medical school, and subsequently, you're specializing in rehabilitation. How does your PhD influence your patient care?
Well, that's kind of an interesting saga because when I was in Baylor University back in 1970s, which is a long time ago, in your senior year, you really don't know what you're going to do with your life, and the only thing you care about is waking up late and partying on Friday night. But so you're trying to fill up your academic schedule with something that's easy, and so there was this course on psychophysiology, and I thought, well, that'll be interesting. So, and the neat thing about it was, and of course this is how you think as a 22-year-old male, the professor was good looking. So that's really the criteria for me taking the course. Well, after about a week in there, I was just absolutely fascinated with the brain. And it's like a switch came on. I thought, this is like the new frontier. This is the most amazing thing I've ever seen. So, and it had a lab associated with it where the professor would take you in and had little mice or rats, and you'd put electrodes down their brain and you'd stimulate them, and you could teach the mouse how to self-reward for a food pellet. And I thought, this is like the new frontier. It's incredible. So for some reason it never left, and after I graduated from college, I went ahead and did a master's in psychophysiology and human behavior and biostatistics. And again, I continue to get more and more interested in this. So I decided I'd do a PhD. So I did a PhD, and then that kind of channeled me into neurochemistry. Neurochemistry is like the new frontier. It's like Star Trek. And we know so very little about the brain. And to try to put it all together in some kind of a make sense out of it story is a lifelong procedure. So I did that. I did my PhD in neuropharmacology in Dallas, and then I decided, well, I'm tired of working on animals and baboons and dogs and stuff. So I think I'm more suited to to humans. So I decided to apply to med school, got to med school and went through that. And at the end of med school, then you have to decide, well, what are you going to do with your life?
Exactly.
And so nobody really knew what physiatry was in my med school. So, but I had a friend who had started a physiatry practice in San Antonio, and he said, you know, you ought to think about physiatry. It is where you actually work with humans, you get them moving again, and you get them functioning and independent and home. And I thought, you know, that's really interesting. So I applied to residency program there at Baylor College of Medicine here in Houston and did my residency in it. And it's the perfect specialty.
Absolutely.
To integrate neurochemistry and everything into trying to get a human back on their feet and walking and moving again.
So let's clarify. So physiatry, or is it physiatry? That's the debate between us physiatrists.
No one will ever resolve that.
Or should we just say we're physical medicine and rehabilitation doctors?
It's easier, much easier.
I mean, have you been called a psychiatrist?
Oh, yeah.
How many times?
Oh, countless. Yeah.
Countless times, right? But I do love to clarify this issue with people because we're passionate about being physiatrists.
Indeed.
We love what we do.
Yes.
We know what we do.
Yes.
But to educate people what we do is so challenging.
Yeah, it's the challenge. That's the worst part of the specialty. It's easy to say you're a surgeon. Everybody knows what that is.
Everybody knows what that is.
Right.
But I mean, you went to Baylor for residency, just maybe a year or two before I did.
Yeah, well, it
so
shows.
I think that's cool.
It shows. I have no hair and everything is gray.
I think it's cool that, you know, we did training in the same field, the same program, however many years apart that was. But we have so many different options from our field and what we could branch out into, but still with the same goal of making people functional. So that's what I love about our field.
Yes. You know, there's so many avenues to take in physiatry. You take a patient that or a doctor that just wants to do pain management because that switch got turned on, as in your case. I have other patients that are doing, other doctor friends that are doing sports medicine exclusively, and it's a fascinating field. You can make your choice, and you can practice as much internal medicine. You can deal with diabetes, you can deal with heart disease as much as you want to do that. So it's a good field to be in. I like it.
Absolutely. It's got to you to where you are now.
Yeah.
It's got me to where I am. So
that's right.
I'm happy.
Yeah,
You're happy.
I am indeed.
So you received your PhD in neuropharmacology and cell biology prior to med school, but now with the rehab, I mean, how are you adding that to the inpatient world?
That's the perfect integration of science and medicine, and I don't think doctors do that very much. I think we're so hung up on what the new drug is that the new pharmaceutical company is putting out, and this will fix this, this will fix that. But you know, in the brain, that's not how the brain works. The brain is this huge symphony of chemistries and structure and networks. So the challenge is really, how do you integrate that in to how to make a patient better, or walk, or get up out of bed after they've had a stroke, or in Alzheimer's, how do you fix that brain so that they begin to remember who they are, or who their wife is, or who their kids are. So that all comes down to manipulating the symphony. Is the clarinet section playing? Is that part of the brain working? And so that's where the challenge is. And when we begin to find out that the brain could fix itself, then my switch really came on. So
and you just have to feed it the right things to switch itself on and off, right?
That's right. See, God put you together just right. And if you figure out what that chemistry is, and you put all that back in, and my example is this. A young girl learning how to play the piano. And she sits down and she labors through the first few keys, and she's looking at the music, and the parents are in the back room with their fingers in their ears. But after about a week, it begins to come smoother, and after a couple of weeks, she could play that thing even without the music on the stand. And you wonder, how did that happen? How did the brain decide how to make those connections? Because the sound's coming in, the brain's registering that, it's telling the rest of the brain, hey, that's the right sound, and the finger moved exactly where it needed to be. So the output of the brain went to the hand to tell it what to do. How does all that happen? And 20 years from now, 40 years from now, she'll still remember that same pattern. She'll still be able to play that music.
Absolutely.
Even without the music on the screen. So
that's amazing what the brain can do.
Stop and think about how you can reconnect. So the same thing applies to strokes. Let's say your father had a stroke and he can't move his right side. But if we put the chemistry back in the brain, like that young girl has playing the piano, then we ought to be able, with some practice, with physical therapy, with occupational therapy, practicing walking and moving and transfers back and forth from a wheelchair, we ought to be able to repair things.
Wow.
And that's how it works.
That's how it works. But I would think if you can also repair things like that, you might even be able to prevent things.
Oh, it's both. That's exactly right. You know, all the chemistry that's in the brain is designed to both protect it from an injury and then rebuild it. So there's three things that your brain has to do every single day. And if you have an injury, then the brain has to figure out how do you repair itself with that injury. So the first thing that happens with an injury is the cells explode and they leak out stuff, and that kills off a few cells, and then that kills off more cells, because every time it kills off a cell, that explodes. So it's like this bomb that keeps going off, and the lesion or the hole in the brain gets bigger.
Wow.
So if you stop it, though, you can turn it around, and you can limit that damage to a very small area so that the recovery process is much faster. So the brain repairs it or protects itself by releasing things like CoQ10, and this is classic functional medicine. Everybody knows about that. CoQ10, alpha lipoic acid, which is an antioxidant, carnitine, which allows the brain to survive in times when it doesn't get enough oxygen in blood. All of that is already in there, and if you put more in an old man after a stroke, you ought to be able to protect the brain from expanding this lesion, this hole that's beginning to generate in the brain.
That's pretty amazing.
It is.
You make inpatient rehab sound exciting.
No, it is.
I mean, obviously for the people there, they don't find it exciting. They just want to get better and go home. So let's explain to people at home. So for those of you who don't know what we mean by inpatient rehabilitation, it's a place that people who can't go directly home from the hospital. Inpatient rehabilitation is the stepping stone, usually to get home safely. So people that have suffered from a stroke, a brain injury, some sort of trauma that can cause spinal cord injury, or fractures with multiple surgical repair, anything that sets someone back severely enough that they're not yet safe to return to their home setting. But Dr. Clarke makes it fun. He's formulated groundbreaking treatments for his patients, for which I'd love for him to elaborate.
Well, yeah, that's an interesting thing because it's a progression. We didn't know the brain could even repair itself until somewhere in the early 90s. There was some hint at it back in the 1960s, but nobody really gave it any credence because for 100 years before that, they thought that the brain, all you had was what you got. And even my mom used to tell me before I went off to college, don't drink too much, don't do drugs, because you only have a few brain cells and you can't afford to lose a single one.
And eat your broccoli.
Oh, you eat your broccoli. And I'm sure that was an insult, but it didn't register. It didn't have enough brain cells then. But then in 1992 or 93, we had a couple of studies that actually, with the new microscopes, electron microscopes, and the new DNA things they were doing, they found that there were stem cells in the brain. And boy, did that revolutionize the world. That means stem cells are the repair cells of the brain. And if you can figure out how to make those stem cells turn into new brain cells, and then incorporate them into the network, touching each other and talking to each other, then you can repair things. And that's how the brain works. That's how that young girl on the piano was sitting there trying to learn that piano. She's making new cells and she's connecting those cells so that everything works as a network. So in the 90s, I thought, okay, how do you do that? What's going on in this young girl's head?
Right.
What does she have that the older fellow with a stroke or the mom with the Alzheimer's. What does she have that they don't have? And let's put it all back in there.
Well, I think stem cells are such an amazing treatment for everybody. And I mean, I have such passion about it for my practice.
Yes.
For joints.
Oh, you especially, yes.
But I mean, the fact that it can heal the brain as well, I mean, it's beyond fascinating.
It is.
Well, before our next topic, we're going to shoot to a commercial break. I'll be bringing Dr. Clarke back on to talk about more amazing things regarding wellness and healing. I'm Dr. Suzanne Manzi, and this is Pain Diaries on NowMedia TV. We'll be back. Welcome back to NowMedia's TV show, Pain Diaries, broadcasting here in Houston, Texas on channel 2110. We are back with Dr. Lewis Clarke. Welcome back.
Welcome back indeed. I'm happy to be here.
So next I want to talk about functional medicine, bioidentical hormones, and supplementation, because we want the brain to work.
Yeah, an interesting thing about functional medicine is that all the things we learned and we grew up with as kids, all that chemistry, when we were young, it made us grow. It made us turn into, from an adolescent to a man or a woman. But now, in our later life, those same hormones, that same chemistry, repairs stuff because everything's beginning to wear out, whether it's brain or whether it's muscle mass or bones or joints, whatever it is. So those same hormones that work to make us grow and become adults are now repair hormones. So we talked about stem cells in our brains because even at 90 you still have stem cells in your brain hanging out, waiting to be told what to do. And it's those hormones that give it the signal. There are receptors in every cell that if those hormones hit them, it tells the cell, okay, time to turn on the switch. It's time for you to become a memory cell. It's time for you to become a motor cell, a movement cell. It's time for you to become a cell that will send out its little axon to connect another cell and connect the network. It's time to turn into an insulation around that cell so it doesn't short out. Every cell has a job, and it's those steroid hormones like we grew up with, testosterone, estradiol, DHEA, pregnenolone, all of those things that we take for granted when we're growing up, those are the cells, those are the hormones now that repair.
Right.
So we put all that back into the body, and it's really remarkable how things happen. And it's unfortunate to me that there was this big move back in the early 2000s to take everybody off their hormones. Don't give the men their testosterone, don't give the women their estradiol. And all of that is just devastating. You lose your ability to repair.
Right, the people that have suffered now with osteoporosis because their bone density has gone so downhill.
Exactly.
It's so sad to see what has happened.
And unnecessary.
And because of misinformation.
Yes.
All misinformation.
It's exactly right.
And because of one paper that said this one type of hormone could possibly cause cancer.
Right.
And maybe everybody got taken off, even though it wasn't those
That's right.
that were causing the cancer.
Exactly.
So it's really sad.
And think about it, you have, maybe there's a risk of cancer in certain types of hormones and certain genetics in certain patients, but that risk is teeny, but it's 100% probable that a patient will get osteoporosis if they're not on their hormones. So 100% you're going to have bones like styrofoam, versus a tiny 0.5% that you might get a cancer of some type. I think, if you were in Las Vegas, you'd go with the 100%.
I would put all my money on that, for sure.
Get yourself back on hormones, get bones growing again.
I tell my patients, do you want to roll down the hill really fast? Or do you want to just roll nice and slow and enjoy the ride?
That's great.
Because if you just don't do anything, you're just going to age as fast as possible and you're done. Off the hill you go.
Exactly right. So those same hormones that make bones, the same hormones that make and protect your heart. You know, estradiol protects your heart muscle.
Absolutely.
The same things that protect your joints and all of the other structures in your body, they protect your brain. And they repair your brain. They tell those stem cells that are hiding up there, hey, it's time to turn into something, time to build back the network. And that's what we use. So it's not just that, but there's all of the other things that belong in the brain. You've got CoQ10, you've got carnitine, vitamin D. Vitamin D is a hormone, and vitamin D will bind to those same receptors, and they will also stimulate the stem cells to begin to morph into new things and things that you need to repair the brain.
But what's crazy, I mean, the vitamin D, when you get the labs back, it says, oh, normal's above at 30.
Mm-hmm.
Like 30? That's not where it's protective. That's not where it does its job. And so people think they're in a normal range, but they're not. They're not optimized.
That's right.
And to have the same conversation over and over, we need to educate people about optimizing their lab values,
Yes.
not just, are you within that range? Because that range was developed however many years ago based on sick
Before we
people.
knew all this, before we knew a lot of this science. And how many doctors actually get those labs? How many say, all right, I'm going to get vitamin D level on you. I'm going to get a name a lab, estradiol or testosterone.
So few.
I have patients that come in and no doctor has ever checked their testosterone. And this man is in his 60s. He has no energy. He's got no muscle mass. And the first thing that would come to my mind is, well, what makes muscle mass, bone, and keeps energy and the brain working in a man who's 60 years old? Well, testosterone is huge, right? So why wouldn't he check that level in the lab? I don't know.
It's just a lot of the functional medicine beliefs and concepts about function are just not taught in medical school. They're not taught in internal medicine. They're not taught in cardiology. And we're so individually specialized now as physicians. You know, we have to go the extra mile to make sure our patients get the best treatment.
Yeah, that is true. And you got to pay attention to the new stuff coming out. And if you read, I mean, you're a reader, so you really understand it. But a lot of doctors go home and they sit down, they have a beer, and they watch TV, and they go to bed. And because I think we all get in our mode. But if you're really fascinated, if your switch is turned on,
right?
And to me, it's neuroscience. With you, it's pain management and all the other functional medicine that you do. Then you can't not read. You see something on the internet, you go, oh, that's interesting.
And something doesn't make sense.
Yeah.
And you're like, wait, well, why did I see this in my office? And this patient was very confusing. You start reading about it, and then you're like, oh, maybe it's this.
Exactly.
But that patient says, no, my doctor says it's this. And you have to kind of really do that research to see each patient's individual. And you have to individualize their treatment to them. You have to make sure you check the right labs.
Yeah, and the chemistry of the body and how it works, the symphony is so fascinating that if you're at all interested, then you go home and you say, you know, that patient had this inflammation of that joint, and you know, and her mom had an autoimmune disease, and my lab shows this, and so you start putting the pieces together and try to fix. So the next time you see the patient, you go, here's what we're going to try. It's outside the box, but here's what we're going to try.
So I know, even a few years ago, just back to the vitamin D level, you know, 30 is, quote, normal, which is so low, when there was a lot of research, you know, okay, you want it up to 60 for some protective effects. Now it's up to 80.
Yes.
And I mean, it keeps changing. But how many people have you seen with a vitamin D level of 80?
Oh, very few. In fact, I think my
exist.
all-time low, you know, at the hospital, I'll bring a hospital patient in because they had a stroke or something. The all-time low, I think, was 4. They had a vitamin D level of 4.
Wow.
No doctor ever checked. It's a 70-year-old lady. Why wouldn't you check? And of course, they're not on hormones. They're not
And her
on
bone density.
Bone density of styrofoam, right?
Right. So if you get her out of bed and she falls, then there's a hip fracture.
Oh, at least one.
At least one.
That's
if
right.
not other bones.
You know, I'm really fortunate because I work for a hospital corporation called PAM Rehab Hospital, and the owner of the hospital, of course, is very user-friendly and very open to these new things, and so he allows me to use supplements. He allows me to use these hormones, and of course, you know, it's all judiciously done, so I'm not doing anything so far out of the box that we would go downhill with it. But the whole idea is to try to put people back together, and he sees that, so it gives us the opportunity to to experiment with some things, not really experiment, nothing harmful, but different supplements, and you see these dramatic changes in movement. Even 6 years after the stroke, you'll start seeing an arm move that that hadn't moved in 6 years. So,
what's the typical patient population you're seeing?
oh, that's a good question. It varies. You know, everything from a broken hip to strokes,
Okay.
Alzheimer's, multiple sclerosis, Parkinson's. There's every neurologic disease you can imagine, but we treat them all.
That's amazing.
Yeah, it's fun.
So tell me a little bit more about the supplement you're talking about. Is
Well,
it just one supplement, or is it a combination?
Well, it started out with just a few back in the 90s,
Okay.
and then it evolved because as more papers began to come out about, hey, you know, vitamin D will make new brain cells do this, or DHEA, which is a hormone that comes out of your adrenal gland, that will also make short-term memory improve. So I thought, okay, well, let's try that. So as we began to put it all together, we put CoQ10 to speed up the metabolism of the cells. We put in all of these hormones that we knew that the literature, scientific literature was beginning to show would repair and restore. And it evolved into this supplement called Nupanex, and I ended up patenting it. And it was an unusual patent because, first of all, the patent office only looks at components. So they say, okay, there's nothing out there quite like this, so we'll give you a patent on this.
Okay.
But in this case, they also patented it based on what it was supposed to do, which was also part of the patent application. And so that was an unusual thing. And what we found over the years is that we've had some patients on these supplements for 5 to 7 years, and they improve. We're treating a lot of patients in the NFL that are retirees that are restored a lot of their cognitive function, and of course that in combination with functional medicine with the hormone replacement is just marvelous outcomes. There's no reason why we should age as quickly as we do, and there's no reason why we should ignore what the body's supposed to do. We should think of ourselves as that little girl next to the piano. Mm-hmm. How are we going to make this body do what we want it to do, and not lose that?
Right, and I feel like we have one body.
Mm-hmm.
We get one. We can't have a body transplant.
Nope.
Yes, we might be able to replace organs if they die or something, but good luck getting on those lists. And
Get on the list. That's true.
But I mean, we have one body. Like, we need to take care of it. We have to feed it the right things.
Right.
We have to move it the right way. I mean, there's basic science behind however much movement we're supposed to get a day.
That's right.
And what we're supposed to eat so we get the right nutrition and things like that. But people don't seem to understand that.
No. And it's like in your specialty, you treat a pain problem, but you don't tell them to go home and sit still, right?
Right.
You get them moving. So that's the same principle as in what I do with my stroke patients. You give them all the chemistry. Now it's all there, but you've got to have the therapies. You've got to have the physical therapy starting to move that arm. Even when they think they can't, suddenly they'll begin to see a twitch, and the therapist goes, "Oh my gosh, you twitched," and so you begin to just expand on that and work it. So it's all about movement. The whole body has to work together because we only have one.
Right. And I mean, now the recommendation is just 10,000 steps a day.
Yeah.
I mean, I do 10,000 steps usually most days, but
Probably in the morning. You're done by 8 o'clock in the morning.
I'm usually done by 6,000 or 7,000 by then.
Yeah.
But,
figured.
then the rest of the day I'm like, oh, I just have to do 3,000.
Yeah.
But yesterday I actually didn't, it was a day off. And when I got home, I watched that I only did 2,500 steps. And that was it. Just by going to work and coming back. So it's minimal.
Yeah.
So you actually physically do have to go for a walk.
Yeah.
And move.
Right.
And, do what you need to do to keep your joints moving. Our bodies were not made to just sit here.
Mm-hmm.
If you sit here, you just rot.
That's right. There's probably a study about a certain number of hours of sitting is actually makes major neurologic and joint and structural decline.
For sure.
I don't know what that study is,
I
but
mean,
I'm sure there's one out there.
But your tendons shorten, especially your anterior compartment here in your hip.
Yes.
Things tighten, and it causes back pain, and it causes dysfunction along the entire kinetic chain. and people suffer from back pain and joint pain just because they've been sitting all day.
That's correct.
So it's a constant battle of educating and hoping people can protect their own body.
Mm-hmm.
So I want people to live long. I want people to enjoy their
Right.
life here on this planet.
Yeah, and we know so much now
Exactly.
that we don't use in medicine, and what we're trying to do is to try to bring that out and say, all right, well, hey everybody, there's more to it than just taking Lipitor. There's a lot of things out there that you can do that will repair your body.
Absolutely. Well, on that note, I would say let's go to a commercial break, and when we come back, we will continue our exciting topics of repairing the brain and more chats with Dr. Clarke.
There you go.
Stay tuned. Hi, Dr. Suzanne Manzi here with Performance Pain and Sports Medicine, and my special guest, Dr. Lewis Clarke, MD, PhD, talking about all things about repairing the brain, functional medicine, and regeneration. So, welcome back.
Thank you.
I wanted to talk a little more tech.
Okay.
You described something called the neurologic destructive sequence. What do you mean by that?
It's how the brain, what happens to the brain when it gets hit or injured, whether it's a stroke, it's suddenly like that, or whether it's a concussion, your
Okay.
child gets hit on the football field and they're down for the count. What is happening on the inside of the head? In Alzheimer's, the same thing happens. It just takes a time over years. So the first thing that happens is, and we briefly talked about that, the cell membrane is interrupted because the brain has sloshed into the front of the cranium and then back and forth, and so the brain is damaged. The cell begins to leak out of that membrane. It's not supposed to leak. Everything's supposed to be contained in that little bag of cell membrane. But when the contents leak out, then they begin to attack the membrane next to them, because those free radicals, those oxidants, you know, we hear about antioxidants. We're supposed to be on antioxidants.
Right.
So those oxidants will attack the cell next to it, and then it'll explode, and pretty soon you have this cascade. And the example of that is a patient that comes in the emergency room and he's complaining of a tingle in his hand. And he goes, my hand's really tingling. So the doctor takes us the CAT scan. The CAT scan's normal, and it's going to be normal for 3 days, so it's kind of a waste of time to take them in. You should automatically assume something's going on in that brain. But they send them home, follow up with your neurologist in a couple of days. But within 24 hours, that whole side of the body's paralyzed. So what has happened is you had a tiny area that got an insult because it didn't get enough blood and oxygen, but then it began to expand because it's damaging cell after cell, and pretty soon that whole side of the brain is gone, and now you have a stroked out patient. So what would you do then when they first come in the emergency room? And I've had patients come in the emergency room, and I've been able to, back in the day when we were allowed to use supplements in the emergency room, I'd load them down with CoQ10 and carnitine and alpha-lipoic acid, all those basic supplements that we know scavenge the free radicals, those major antioxidants of CoQ10, and they fire up the machinery of the cell. Carnitine is one that does the same thing, but it allows the cell to burn fat. So now, even without blood supply and oxygen, that cell is beginning to continue to survive until it gets the blood restored to it. So CoQ10, carnitine, and alpha-lipoic acid, those are the things our body uses to scavenge the free radicals and to survive a period of injury time. So if you can do that, you can stop that cascade, that atomic bomb that's continuing to explode in more and more cells. And I've been able to see just dramatic changes in a patient that comes in the ER and they couldn't see, and within a few hours we were actually getting their vision back or their movement back. And this is a patient that would have normally been blind and paralyzed for life. So we know that we can stop the process if we put back in what's supposed to be there.
Okay.
And this, what the other thing that happens is not only these free radicals that escape the membrane bag, but also the neurotransmitter, the chemistry that is sending messages, that escapes, and that kills off more cells. So then there's also inflammation that sets up after that. So inflammation, oxidation of free radicals, and also these that's right.
Is the same sequence similar with like the traumatic brain injury and neurodegenerative type diseases?
Yes. Yes, and those are more sudden. You know, the Alzheimer's problem is it's an ongoing inflammation and oxidation and all those free radicals and everything off.
And I know in my recent studies with like obesity medicine and you know, with the diabetes behind that, is a lot of that's connected to Alzheimer's as well.
Oh, indeed. Yeah, you know, diabetes is all about inflammation.
Exactly.
And free radicals oxidation, sure.
So again, it's eating well and eating right and trying not to become type 2 diabetic.
Yeah.
To potentially, especially if you have that Alzheimer link, how important it is to eat the right things and protect yourself.
Minimize hamburgers and fries.
And soda.
Soda. Oh, yeah.
Soda.
All time.
Sugar water, right?
Yes.
Liquid candy, as I call it.
It is.
I can't tell you the last time I had a soda.
Yeah. You know, when my kids were growing up, I tried to sell them on eating fruit. So I used the term God's candy. This is God's candy. To taste it, it's as good as that lollipop over there. Yeah, eat God's candy. We don't have to go to any great lengths to make our own.
We don't need to get it out of a package.
No, it doesn't have to have bubbles in it.
Exactly. Exactly. So, yeah, I mean, all amazing things. We just want to help people protect themselves.
That's right.
Be functional, live long, and hopefully if something bad does happen, we have a little bit more information and science behind how we can make it not so traumatic.
Right.
And make it less catastrophic and hopefully functional for that patient to be able to go home and to be able to enjoy their family and the rest of their life here.
That's right. Yeah, you can add, I mean, our big message, of course, is to add a diet that's appropriate, exercise, which is appropriate, but then when you throw in all the chemistry that we know about and how the new science of stem cells and how can we grow new joint and cartilage, all of that we know now that very few doctors use. Well, okay, pay attention, start reading about it, start using it.
Exactly. So I'm in the Greenway Plaza and also office down in League City. Where can people find you?
I'm down in Clear Lake, which is Webster, Texas, so halfway between Houston and Galveston. We have an outpatient practice where I see patients, but we also have the inpatient hospital at PAM Rehab Hospitals, and that's where I see all my inpatients.
Great. And what do you think the future holds for you, Dr. Clarke?
Well, you know, there's so much information about this, and nobody seems to know it, and that's why I love sitting and talking to you, because you have that same mind of curiosity. But I'm trying to write this book, and I'm about halfway through.
Beyond Awakenings. Right?
Beyond Awakenings.
I love that title.
Yeah, you know, back in the 1970s, this guy wrote a book called Awakenings, and it was about giving dopamine to these patients who had like an encephalitis, and they woke up. Well, Robin Williams made a movie back in 1990, I think, about that, and the problem was that it worked for a while, but then it didn't work anymore. And the reason was they were giving something that was missing in the brain, the dopamine transmitter, but they didn't give the whole symphony. And so now that we know about stem cells, and the movie was made before they even knew what stem cells were in the brain, and so now that we know that, and now we know we can make them turn into brain cells, it's beyond awakening. We're not just waking them up, we're actually repairing things. So that's why it's beyond awakenings.
I love that. So you're currently writing this book?
Yes.
When do you think it will be available?
Not tomorrow.
And I know you spend a lot of time writing.
Yeah, I do.
Because you have to obviously make sure the sources are right and the references are right. It's so much work to write a book.
Yeah, and Suzanne, it's like a culmination of 30 years of working on these projects, and so trying to remember what was I thinking in 1999. So I may have had in a computer, so well, is that computer still available? Can I even go back to that hard drive? So there's so much information to integrate, and I'm hoping that I can get it out so people can start paying attention and using it.
That's so exciting. Where can people find you on the web?
I have a website, drlewisclarke.com. You can also go to Clarke Bioscience that has some of the supplements that we have put together, both for bones and for brain and various things. So those are things you can go to look around. And I have a lot of YouTube things out there that I think are sometimes a little too technical. Sometimes they really minister to you. So I'm available out wherever.
Well, Dr. Clarke, I really appreciate you being on the show with me today, and we hope we can change the lives of patients.
Dr. Manzi, let's work together. Let's fix people.
Stay strong.
Yes.
And my motto here on Pain Diaries is take care of you so you can take care of business.
Yes, we'll do it.
So thank you so much for taking the time to share your story with the world.
Thank you for inviting me.
Absolutely.
It's a great treat.
We appreciate all you do for your patients. I'm sure we can keep talking and talking, so I'll have to have you back on the show.
Well, let's do it again.
I'm Dr. Suzanne Manzi. Remember, take care of you so you can take care of business. And this is Pain Diaries.
This has been a NowMedia television feature presentation. All rights reserved.